And welcome to Senior Moments. This is a broadcast service of Cleveland Community College on Spectrum Cable. You can also follow on C19.tv. And we hope that you do share that link with family and friends. I am Jackie Sibley Newton, your host, and today's guests are with Via Health Partners, formerly Cleveland County Hospice, and also Equity Health. Am I saying that right?
Equity Health, yeah.
And Equity Health has a partnership with Via Health.
Yes, we are a subsidiary.
So I'm going to let you guys explain how that partnership works.
I'll let you take it.
Thank you. Yes, of course, Via Health Partners, we were formerly Hospice and Palliative Care Charlotte Region, and in November of 2020, we took over the Cleveland County operations here. So Hospice of Cleveland County is now Via Health Partners Cleveland County. Mm-hmm. And so as we've grown as an organization, and today we have approaching 1,100 employees in North and South Carolina, serving in any given day over 3,000 patients, we knew that there was a missing element of our service spectrum. We did not have, we had hospice, we had palliative care, we did not have primary care. So just in a meeting on our campus one day, Michelle was attending, Michelle Smergy here, who's the president of Equity Health, and we began talking, and I said, you know, they have exactly what we need, and that's a primary care arm. And so that began a conversation that probably took a year or so to come together, but it really was an opportunity for us to really reach more people, to serve more people of need, and to also really help strengthen the organization. And so we just thought it was a great partnership in terms of two organizations that shared a similar philosophy, that it's patients first, it's about excellence in care. And so through those conversations, we became one organization. And with that, I'll just let Michelle really explain more about what Equity Health's all about.
Okay, and Michelle, I didn't introduce Peter either. Peter Brunick of Via Health Partners,
Right.
And Michelle Smergy, I almost got it, with Equity Health. And Equity provides the physician part of and the healthcare part of Via Health. Am I
A small part. So
understanding
there are
that
still
correctly?
we are a group of nurse practitioners who provide home-based primary care predominantly. So we go out into the homes or out into the community and serve patients wherever they live. It could be an assisted living facility, an independent living facility, or their own homes.
Yes.
There are physicians and nurse practitioners in both the palliative and hospice division. Ours is just the one focused on primary care.
Yeah.
Yeah.
And I know that at Terabella,
Yes.
Equity comes in and provides that primary care for a lot of the residents who are there. And that is very helpful because you just come and provide the service there. They don't have to go anywhere.
Yeah.
It's right there. And that's the same thing that you provide for the homes.
Yeah, exactly right. So we
Okay.
really like to take the care to the patients. There kind of comes a time in everyone's life where your disease burden or immobility or mobility challenges become so great that it's so difficult to either get out of a home or get out of a facility. And so we decided to bring the care directly to those patients.
That is very convenient. And I know that even with some of those services, if you needed, perhaps you couldn't get out to an x-ray, some of those services even include bringing in a mobile x-ray service.
We do. We coordinate with mobile x-ray, so we get those to come out there to see you. We do all of our lab work, any diagnostics that are needed, we get that coordinated directly to the patient.
That is so much more convenient because if there is any kind of injury, that's even less movement before they have to go
Yeah.
and get something looked at. So
Yeah.
that is a whole lot more convenient, and they're less exposed to things.
Yeah, thank you for saying that. We worked hard to do that
Yeah.
on behalf of patients.
It
yeah.
is. It's a beautiful partnership. So tell me more about how this is working.
Well, I think it's working extremely well. Again, it's about two organizations, two teams that come together who share the same philosophy. I do want to emphasize that Via Health Partners and Equity Health, we're a nonprofit, and so we're not owned by anybody. We're not in a world today where so much of healthcare has private equity money. It has owned by gigantic billion-dollar corporations, including in the hospice space. We are an independent, freestanding nonprofit. And so with that, it's always about patients in mind. And I think it's, with Equity Health, we can reach people today that we didn't have a service to really address their needs.
Right.
And there's such a great number of people out there, as Michelle said, who, for whatever reason, they can't get to their doctor. Again, it could be for various reasons, and we can go to them. And so it's really, it's worked extremely well, and I think we've been able to grow, and Michelle can talk about the growth that Equity Health has experienced since joining us.
We've honestly grown so much. It's been just a tremendous experience over the past year. We've gone from 5 counties to 20 counties here in North Carolina. We have grown from 3 nurse practitioners to 9 present state. And so we're really focused on kind of educating both the clinicians and patients in the community on the services we provide and trying to get that great high quality care directly to patients.
Now, is this something that is done in other hospices across the country, or is this kind of a new model?
I think it's fairly unique. There are organizations out there, hospice providers, that might have a similar type service. I don't think they have one that is the quality of Equity Health. And the great thing about it, sometimes when they have what I would call a geriatric type program, there isn't a hospice attached to it.
Yeah.
And sometimes those programs actually delay patients going to hospice. We really have we're so well integrated that patients get the right care at the right time. So if they need hospice services, we know when to transition them to that hospice service, which is something that I don't think there's many hospices across the nation that have a model like we do.
It seems very unique, and knowing what's going on in some other states around us, I've never heard of this kind of cohesion with just the flow of the level of care and being that gentle, easy flow into each level as needed.
Well, and one thing I want to share with the audience, that for those, and this is people here in the Cleveland County area, that through the merger and through having Equity Health, the hospice care that's delivered here in Cleveland County is world class. In other words, what is being done here in terms of sophistication matches anything in the nation. And that's been a byproduct and one of the great benefits of coming together. And now Cleveland County really serves the hub, what we call our foothills region, which is Cleveland, Rutherford County, Polk County, McDowell County, and Burke County. And so this is our hub for the western part, what we call our western region, our foothills region.
Right.
And Michelle's service area is now beginning to match that too.
So it's just continually growing and getting bigger.
It's wonderful.
So let's talk about the level of care, because people hear hospice and they automatically think, oh, we're dealing with end-of-life care. But there's so much more to hospice that is not just end-of-life care.
Well, there's a lot of misconceptions about hospice. One misconception is that hospice is a place. In other words, they know the Wendover Hospice House, they know the Testa Hospice House, but we do 97% of our patients are served in settings outside of a hospice inpatient unit. You know, hospice by definition is a patient who has a prognosis of life for 6 months or less. And the great benefit of that is that when you come to a point in life where curative options are not available, in other words, your disease is not going to be reversed, and the trajectory is towards death, that hospice is such a great service to provide. And we provide pharmacy, durable medical equipment, meaning wheelchairs, walkers, beds, whatever. We provide all the medications, and for most patients, there's no cost, and that's the great thing for people who are struggling to get medications for their loved ones or supplies for their loved ones. When they're under hospice, that's all covered.
Yes.
And so we're walking that journey with these patients, helping them live their last months, weeks, days of life to their fullest, and allowing them to really be human in those really last stages of life. And that's what hospice is all about. And I know people think, well, it's giving up. No, it isn't. There comes a point in time when surgical options, other aggressive options just aren't really, there's not beneficial, and actually it can harm the quality of life, not enhance the quality of life. And that's what we do. And again, working with Equity Health, reaching people who are not ready for hospice, but they're very sick and they're frail. And so we can provide care for them when they haven't reached that 6 months prognosis. And so this great partnership really has created a strong bond for patients across the spectrum of care that really enhances the quality of so many people.
And it preserves dignity.
It does.
It preserves dignity in a way that I've been able to witness how patients have a voice in their care. They're able to work with their caregiver and voice their own opinions, their own beliefs in, well, this is what I want. This is what I want to see done. Or this is how hard I'm willing to work to get better. I want physical therapy, or I want to do this. I want to pursue, and we're going to all do that. We're going to work as a team and make sure that all of that's happening, and I've seen that happen. So it's been a joy to watch that and be part of it. So I'm glad that I know a little bit about Equity Health and what's going on. So talk to me a little bit about that level of care, of where we come in, maybe on the palliative level, and talk about what happens with where you come in on the level of care.
Yeah, so we tend to be the patient's primary care provider in the community, but a lot of what we do, we usually try minimally to have goals of care discussions twice a year. And we want to know what you want, what are your desires, what does the last few years look like to you, and how do we make that happen in conjunction with your family members. Oftentimes what patients choose is very different than what their adult children choose, or even grandchildren. And so really helping facilitate those conversations and letting people know you have options, here are the options, and how can we help you coordinate all those services.
And put in a little bit of realistic goals too, because sometimes the goals aren't, we think that we can do a lot more than we really can. So you have to kind of put in that realistic conversation too of, okay, well, physically, this is where we are. So having somebody from the outside come in and help with those conversations is really necessary sometimes.
It really is, and it's really, really helpful for families. I think planning is the most important thing you can do, no matter your age. So however old you are, please plan for your future. It is really important, because you really don't know when your last few years of life are. And so what are your choices? And those choices change, and that's okay. And so how do we revisit that conversation, make those needs and wishes known, and then treat patients with the utmost dignity is really what we do.
Well, we're going to take a quick break, and then we'll be back in a few minutes to learn more about Equity Health and VIA Health Partners.
What's up, guys? Luke Combs here. North Carolina has a major problem with litter on our roadways. We all have to do our part to clean up this mess. And just remember, trash belongs in a can, not on our roads. Don't trash North Carolina.
Someone once said that without music, life would be a mistake. And that's how we feel here on Face the Music. Hi, I'm Summer Castle-Keever, and I'd love for you to join me each month on our new program, Face the Music, which airs on C19 TV and C19.TV. Each month we'll highlight the talents, personalities, and stories behind some of the area's most gifted singers, songwriters, and musicians. It's going to be a lot of fun, so join me each month for a new edition of Face the Music right here on C19.
And welcome back to Senior Moments. I'm Jackie Sibley Newton, your host, and we have been discussing VIA Health Partners and the partnership with Equity Health. And we are going to talk a little bit more about the difference in levels of care, because we know hospice, and then we know what kind of comes along with when people think about hospice. And we talked a little bit about palliative care, but what's the difference in palliative care and then a primary care?
Yeah, great question. Primary care is sort of the all-encompassing preventative care, your annual visits, vaccinations, any kind of acute visits that come up. So if you get sick, if you get a cold, or if you have maybe a UTI, primary care usually addresses those things for you. And you probably have spent an entire lifetime with one provider if you're fortunate. And there comes a time when you really can't get to that provider anymore. And so what we do is provide home-based primary care. We sort of take handoff from that provider that you've been seeing in the community for many years and really see you in your home, in the comfort of your home. Palliative care tends to be much more of a consultative model for when we can't manage symptoms well, or goals of care discussions. So sometimes, like we were mentioning earlier, a lot of the goals of care require lengthy conversations with multiple different people in your family. And so we usually use palliative care for that, where it's much more of a comfort-focused care of how can we manage your symptoms the best way possible, and how do we do that in conjunction with your primary care provider.
Okay.
And I'm saying sometimes, primary care really is about the whole person and all
Right.
issues. Sometimes palliative care is really focused on a specific issue. Maybe it's COPD, maybe it's some other, maybe it's a
High blood
cancer.
pressure, heart disease.
Right, and they're focused on
Right.
that. Where in Michelle's team, they're covering everything that
Right.
the patient, again.
Just
they're-
like that family doctor you've
Exactly.
always seen,
Yep.
it's just now they're making a house call.
Exactly
We're
right.
just back to house calls.
That's right, we're going back in
Yeah.
time and doing
Doing
it the
house calls
old-fashioned
now.
way, but it's a
Right.
good way to do it.
Yeah, it's exactly the right way to do it. And I think too, going into the home or going into that place of care, you're able to take in so much more. Like when we go to the doctor's office, they're seeing us. They can see how we're dressed, maybe our grooming, but they can't see, is there running water in the house?
Yes, do you have food?
Do they have the proper food? Is the house clean? Are all of the needs being met? So there are some evaluations that can be made when you're coming into the place where the care is being given, where observations are made as well, that really play into, is this person healthy? Are they
Yeah.
getting all of their needs met? So there are some benefits to being able to go into the home and seeing that as well.
Yeah, it's really, really valuable, and it's such an honor to be able to to go into people's homes and care for them in that way. People sometimes are really nervous about that. Oh, my house isn't very clean. I'm kind of embarrassed, but that's nothing to be ashamed of or embarrassed about.
No.
We can help. We can coordinate resources for you. That's what we're there to do.
And you coordinate resources quickly.
We do.
Like if they need a hospital bed, it's going to be there.
We
If
do.
they need a walker, it's going to get there.
Yeah.
If they need a special kind of pillow, if they need something to prevent bed sores, it's going to get there. It's
Yeah.
going to get there quickly.
Yeah, we try really hard.
They're gonna,
Yeah.
they're not going to wait for those things. I've seen that happen very, very quickly. And
Yeah.
those are things that you really don't necessarily see if you're going to that office. You're going to see if they have maybe a wound.
Yeah.
But you're not going to see, well, maybe it's because
Correct.
they're sleeping on a couch. They're not in a proper bed,
Yeah.
but a hospital bed's going to prevent that. Or
Yeah, or an air mattress will
And-
help really help
right.
that wound heal and alleviate that pressure.
And then there's things like frequent falls. Well, why are we falling so often? There's an evaluation. We can do some things to maybe you need a different kind of bed. Maybe you need a fall mat. Maybe there's things that can be done. So there's evaluations that can be done to help with that too.
Yeah,
So I've seen how that works as well.
yeah.
Very helpful.
As we talk about the partnership, one other benefit that has come through this is that Michelle, for instance, can serve as that patient's primary care physician. And as they transition through palliative to hospice, she can remain in that role. So instead of having fragmented care, once they come with VIA Health Partners, they have a consistent care team that's taking care of them. And so it's a cohesive approach to a patient's care versus, again, a fragmented approach.
And that history follows.
Right.
Yep.
You have all of that history that follows with them, the medication history, the health history, all of that follows through.
Well, we've all gone to the doctor, and maybe it's a repeated occurrence, and the doctor says, "So, tell me what's going on," and you feel like, "Well, haven't you looked at my record?"
Is it in my chart?
And we kind of solve that problem by
Yeah.
having, again, consistent care with a cohesive care team that really can walk with that patient through various stages of their health.
Yeah. And also people who genuinely care about what's
Precisely.
going on. It's very personalized care. You're not in there for, I've got 10 seconds
No.
to see this patient. I've got to roll with it. It is very personalized.
Yeah, most of our
And-
visits are around 40 minutes to an hour.
Yeah.
Yeah.
And I don't mind saying in the hospice world where about 75% of the hospices out there are for-profits. And it is a metric-driven form of care where everything is volume-based. Being a nonprofit, it's not all about volume. It's about giving the right care. And so we can take that time with that patient, give them the time they need to really work with them to get them to where they need to be in their care trajectory. And again, that's a unique aspect of this partnership, is that we're not driven by, again, a corporate mandate to generate volume visits. We do it the right way, and we give patients what they need.
Now, for people who are watching who may think they have a family member that can benefit from services, how do they get started? How do they get in touch with Equity or hospice? How does this work? How do they get these services?
They can certainly reach out. Equity's got a website, we have a website, and we will direct them to where they need to go, even if they just want information, even if a family member is unsure about what their family member needs, they just call and ask for information. We can make an information visit if needed and help them, guide them to what would be the best fit for them. So always reach out to our website. You can call. We do this all day long. And it's what we do, and it's a great opportunity for people to learn. And that's something about end of life, advanced illness, end of life. So many people lack knowledge about what the options are. You hear
Right.
people talk about, my parent is in this situation, what do I do? Do I go to assisted living, skilled nursing? And most people really know the difference.
They don't.
And so between hospice and palliative care, primary care, they're unaware of these services. They don't really understand them. So always reach out. I always encourage people, prepare. I know that nobody wants to think about becoming infirmed or going through a death process, but it happens to us all. And just become a student of end-of-life care and advanced illnesses. It's something that's worthy of learning about, so you can do what's best for your family member or loved one.
Yeah. And it's always good to know, even at our age, to know the
Yeah.
choices, because the less that we can take away from our families having to make decisions, to just say, this is what I want.
Yeah.
This is who you contact. I have a little book at my house, and
Yeah.
it has these are the people you call. This is where we go. Just because
Yeah.
it's just a book of resources. Like, here's where you call. This is what happens. This is where it goes. Because I don't want them to have to make decisions. I don't want them to have to think about things. My husband's going to be a mess. He's not going to be able to make decisions. He's not going to be able to think about that. So, it just helps if you have some things that you've already had some discussions with your family about, here's what I want to happen. Because nobody wants to have to make those decisions for you. It's a horrible place to be, to have to make them. So have those discussions and know what the options are, because nobody should have to go through that by yourself.
Right.
Yeah.
And there's so many in our community. Cleveland County is so blessed to have so many options and so many opportunities for people that are just here to help get through it.
Amazing resources in this community.
We do.
Yeah.
We do. So many resources for all the different options, and we all work together so well.
Yeah.
Everybody does, from the life enrichment centers to the senior centers to the hospice centers to all of the resources that we have to work together.
Yeah.
So if they go to the website, is Equity Health something that they can sign up for services even if they aren't through hospice, or is this a
Yes.
partnership through hospice?
No, you can
strictly?
be our patient even if you're not hospice eligible yet. We have a
Okay.
lot of patients that aren't even close to being hospice appropriate or eligible, but that we still help them because of their needs in the community. So mostly kind of homebound seniors, people with a lot of advanced illness or chronic illness. We manage all of those things from the comfort of your home. We have an electronic health record where we can get your prescriptions to the local pharmacy. We know who delivers medications to the home, so we can help coordinate all of that.
That's great.
Yeah.
So true
Real
Home-
primary care. Yep.
homebound primary care.
Exactly right.
Real house calls.
Yep.
With real people. That's
Yeah.
great.
Yeah, and we really pride ourselves on being kind of the best of the best as a medical group. So we have, all of our nurse practitioners have been in practice many, many years. I'm in my 18th year of clinical practice, which is hard to believe. So high quality is really what we're all about.
Okay.
And we have a very strong Cleveland County team.
Yes.
And
Yeah.
so it's, and just, that's so great because the folks here need that. And I'm proud of the fact that they just have, people Michelle has in this community are just top notch.
Yeah.
They really are. Beth and BJ are amazing.
Well, we know Beth.
Yes.
We've met BJ.
Yeah.
Yes. Very, everybody that we've worked with in Equity has been very impressive.
Thank you.
We have been very impressed with the service ourselves. So it's been a great partnership for us as
Yeah,
well.
we agree.
So, and then we know hospice has a website and a lot of services through hospice
Right.
for communication and contact, down from really anything anyone would need if they are dealing with any kind of end of life or close to services.
And I would add to that bereavement and grief counseling.
That's where I was going to go. Yeah.
We do community grief counseling for people, even if your family member or loved one was not served by us through hospice, we still do community grief services.
Yes.
And it's just important to get through. You know, one of the great things that hospice provides people is peace of mind, that you know you can see the end of a loved one's life and know that you did the very best you could for them. And if there's one thing we can give people, and that's that feeling that I did the best I could for my loved one. And leaving that legacy with that sense of closure and not feeling like I should have done more, because you did all you could do, and you got the very best in care.
Yeah. And your grief counselors are amazing. They
are.
make talking about it very comfortable, because sometimes it's not a comfortable thing to talk about, and they really make it comfortable to talk about. They open those doors and make the grieving process normal. They just make it where it needs to be, and allow people that space to feel that process, no matter who it is. I've walked through it with your grieving counselors with children, and my own staff suffered a loss with my staff, and I called the hospice and I said, I don't know what to do. I've got to walk my staff through the loss of a staff member. And they sent some folks over and helped us as a staff walk through that. And this was caregivers. And so we deal with it all the time,
Yes, you do.
but when it's one of our caregivers, we were kind of like, we don't know how to handle this. And they came over and walked with us and came over every day to check on us. So
That's
just
so-
a blessing to have that.
Well, thank you.
I
Thank you.
appreciate everything that both of you do. Thank you so much, and thank you for being on the show.
Well, thank you for the opportunity. We
Thank
much
you.
appreciated.
And I want to thank you for watching Senior Moments and wish everyone happy holidays. And we hope to see you again next year on Senior Moments.
My name is Rich Garofolo. I'm Director of Library Services here at Cleveland Community College. You're watching C19, Cleveland County's hometown station.